Assalamualaikum warahmatullahi wabarakatuh. I'm Raja Aishah, a PhD candidate of University Science Islam Malaysia in the Faculty of Leadership and Management. This presentation is entitled Framing Islamic Organizational Culture for Waqf-based Hospital in Malaysia. Contents comprise of an introduction, literature review, objectives of research, research methodology, critical findings, implications from findings, research contributions of theoretical and methodological, and finally conclusions. Introduction. The Islamic culture in the healthcare services was first documented in 805 century in a Waqf-based hospital in Baghdad, the Tulun Hospital. It is the earliest stage to integration between the Islamic culture and civilization, which resulted in a dynamic and organized institution. Waqf-based hospitals is an important social innovation and should emulate and embed the Islamic teachings in its organizational culture. This Islamic branding is an important necessity for Muslims' lives in their daily submission and obedience in the worship to Allah subhanahu wa ta'ala. Literature review. The organizational culture refers to the values, beliefs, and hidden assumptions that organizational members have in common. Disney, Southwest Airlines, or Ritz-Carlton are exemplars of their distinct organizational culture that each is known for creating, sustaining, and constantly improving a service-oriented, innovative culture. Theories of organizational culture in healthcare is about how the services are run and become established as norms. This study focuses on two theories as they exhibit organizational culture in healthcare. Mannion and Davies 2018, Three Levels of Culture, Shine's Levels of Culture. In Mannion and Davies 2018, Three Levels of Culture, it comprises of visible manifestations, shared ways of thinking, and deeper shared assumptions. Shine's levels of cultures for the artifact, visible and observed behavior, espoused beliefs and values, and basic assumptions. The hospital culture in Malaysia is inherited the Western medicine, the administration of healthcare services, the architectural design of hospital buildings, and even the nurses' uniform from the British colonial rule. They bequeathed us the NHS or British National Health Services. In the development of Islamic hospitals in Malaysia, it slowly began its halal services by initiating Islamic-based hospitals, providing musalla, room and space for Muslim patients and visitors to perform their daily prayers. Though it may be just superficial, it was beginning of the transformation of the provision of Muslim-friendly facilities. The Islamic organizational culture is based on Al-Quran and Hadith. With the organizational culture of Islamic past hospitals, they were based on Islamic traditions of the Al-Quran and Hadith, where medical ethics were inaugurated from the early 9th century and documented, entitled Adab at-Tabib. It included Islamic architecture, Islamic medical ethics, halal medicines, and were also Waqf-based. In the development of Islamic healthcare in Malaysia from the year 2000, literature review discussed numerous times focusing on patient healthcare, Muslim-friendly practices, hospital management, and Islamic hospital tourism. Islam distinguishes work as part of an ibadah and a sense of jihad. Literature review found that discussions began as early as 1989 and focused on medical ethics, working ethics, health services, and organizational culture. The Sharia standards and halal services can increase the quality of healthcare and improve Muslim patient satisfaction. However, literature review showed a gap in the Islamic organizational culture in healthcare, where the organizational culture is comprehensive, ranging from its Islamic architectural design to its services of Sharia standards and within the halal parameters. Research objectives: to identify elements from the organizational culture theories that identify and are compatible with Islamic Sharia standards and within halal parameters. Also, to find other important elements for the proposed organizational culture for the Waqf-based hospital. Research methodology. The methodology used in this research is content analysis from a qualitative research methodology, relying on textual, while hermeneutics provides the method of interpretation and understanding. Data analysis involves manual coding and thematic analysis with pattern matching. The pattern matching is applied to understand the how and why of the deductions. Critical findings. Number 1. In Table 1, comparisons discovered a pattern which shows some striking resemblance between the concepts of the faith of Islam, 3 levels of Osimanian and Davis, levels of culture, Shine. And all these 3 concepts correspond and emulate each other, and the upshot is the proposed Islamic organizational culture in the shaded column, and they are to instill the Islamic culture and profess loyalty and commitment in the providence of good health, personalizing the core value with a slogan or a motto, the physical manifestations of Islamic faith and values and local cultures of Sharia compliance. And then in the application of these elements, the following are defined and explained in Table 2. In Table 2, it shows examples of how they can be implemented in the proposed Islamic organizational culture in Waqf-based hospitals. Critical finding 2 and 3. Literature review also found other elements that should be incorporated in the proposed Islamic organizational culture for Waqf-based hospitals. In promoting halal Western medicines in Islamic organizational culture, literature review also found that the cultural medicines can be complementary to modern medicines. These traditional medicines are already offered in Malaysian public hospitals, such as acupuncture and herbal therapy, which can be emulated in the proposed Islamic organizational culture for Waqf-based hospitals, so long as they are Sharia compliant. Another finding is the organizational culture of resilience, of which growth is encouraged, support is plentiful, and crises are recognized as opportunities. This special mention of resilience during the pandemic highlights the importance of resilience for healthcare workers as frontliners, especially during the recent pandemic COVID-19. From a comparison table in Table 3, literature discusses resilience in Islamic ethics and resilience in crisis, indicating their different strategies in developing resilience in an organizational culture of hospitals, which can help prepare frontliners for other future pandemics and healthcare crises. From the column of resilient crisis, their studies have been shown that resilience can be developed through learning, experience, and formal training. From Islamic ethics, resilience is made up of personal competence, trust in one's instincts, tolerance of negative effects, positive acceptance of change, and secure relationships, control, and spiritual influences. With Islamic spirituality, the human capacity can overcome from adversities much easier, and that Islam promotes patience, perseverance in adversities, and to believe that all that befall are from Allah subhanahu wa ta'ala. Hence, it is measured when the individual overcomes an ordeal, it is with patience, to persevere, equip oneself with positive elements, and to have faith that help will come from Allah subhanahu wa ta'ala, and that He has promised paradise for those who are patient. Implications from findings. Islamic organizational culture can act as a mediating role between knowledge and concepts provided in Islam and addressing the management of healthcare services and the concerns of some stress-related issues in healthcare frontliners. With this newly developed culture in Waqf-based hospitals, it can be an inauguration to a future of many more interesting adaptations of Islamic organizational culture in other public services and even private organizations. Research contribution theoretical. The research focuses on the elements needed to install the Islamic organizational culture based on the Al-Quran and Hadith. The research findings also contribute on identifying other additional elements to fortify the Islamic organizational culture. The research also exemplifies the elements found for their implementations in the Waqf-based hospital. Methodological. In population sample, the study was conducted in the private and public healthcare services regarding the role of organizational cultures. In data collection, the study examines various types of literature of theories of organizational culture in healthcare industry, general documents of organizational culture in public and private healthcare services, and Islamic perspectives in Islamic-based healthcare services. In data analysis, it involved manual coding and thematic analysis with pattern matching. Conclusions. An Islamic organizational culture is deemed necessary for Islamic-based hospitals such as Waqf-based hospitals, for Muslim patients who will feel comfortable and contented that when in a vulnerable and sensitive condition, their religious concerns are well taken care of. And considering the Muslim world population is on the increase, more Muslims desire and demand good healthcare with guarantee of Shariah's compliance and confident of the status of halal of services of hospitals. Therefore, this research is on target and heading towards Islamic compliance of global healthcare services. Islamic organizational culture can act as a mediating role between knowledge and concepts provided in Islam and in addressing the management of healthcare services and the concerns of some stress-related issues of healthcare frontliners. This is also another means of da'wah for Muslims and non-Muslims in propagating Islam. Thank you for listening. Assalamualaikum warahmatullahi wabarakatuh.